You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing in Hayes. Find them in the Next Tech directory.
So, you think you have skeletons in your closet? Come to Sternberg Museum, where we let our skeletons out of the closet.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of the West Central Kansas Smart Start Grant. And with me today is Christina Hayes. Good morning, Christina.
Good morning.
Now, first of all, tell us what organization you work with and what you do with that organization.
Well, I work for the Northwest Kansas Regional Prevention Center, and we're located inside the Smoky Hill Foundation for Chemical Dependency here on 7th Street in Hayes. Mm-hmm. And what we do is we help communities identify substance use risks, basically. So we work with communities to help encourage healthy behaviors and reduce risks.
Okay. Now, what are you here to talk to us about today?
Well, I'm here to talk about prenatal health and development in regards to especially substance abuse and use. The environment influences the baby as soon as they are conceived, and so it's important for women to remember that everything from radioactivity to stress to the outside world, chemicals and especially drugs and alcohol and viruses even in a mother's bloodstream can affect the development of a baby. Mm-hmm. So.
Now, what is some important information that people, especially maybe a mother who is carrying a baby right now, need to know about that period of time?
Well, according to the 2010 Kansas Kids Count data, we had a 3% increase in low birth weight babies. And so from previous years, it's kind of been going up consistently, and there's a lot of things that contribute to that low birth weight in babies. And the three things that I would like to talk about is alcohol, drugs, and nicotine or tobacco. And so these greatly impact the abnormalities and consequences for the baby. And so the first thing I would like to talk about is alcohol. It is the one known drug that has been proven to impact the baby for the most, and not even one drink's okay. Some doctors say that it is, but really studies are showing that it's not okay. And so here I brought some little props for you.
Okay.
I have a fake glass of beer, and then I have a fake glass of wine.
Do you need help?
Would you please? Yes, thank you. And I have a shot glass of liquor here. And so I'm going to ask you a question.
Oh.
If I would say, which do you think of these has the most alcohol in it, which would you say?
I would probably go with the shot glass.
And most people do say the shot glass because it's usually higher content of alcohol, things like that. But the truth is, all of these are equal. So a 12-ounce glass of beer, one small glass of wine, and one shot is all equal. So therefore, it can all impact the baby the same. So some women say, oh, I can have a beer. It's just a beer. It's not a big deal. I'm not drinking hard liquor. Well, it is the same as having hard liquor, and even a glass of wine is the same. And so thank you. So I wanted to show that it does impact. And so the way alcohol gets out of our bodies is we either use the restroom, we breathe, and we sweat. And that's how alcohol metabolizes and goes through the body. Well, when you're pregnant, the baby does things a little bit differently. Alcohol is the one known drug that goes completely across the placenta, so that means the baby is ingesting it right away. And then as they excrete it, it goes into the amniotic fluid, and therefore it circulates. It can circulate up to 3 times in the baby because then they breathe the amniotic fluid back in, then they excrete it, and it keeps going through. So depending on how much the mother drinks, it can be even higher than 3 times. And so that's something I don't think women realize, that that baby is drinking 3 times as much as you are, even with one sip. And so that's something that I think people forget about a little bit.
I had never thought about that. So that's very important to know.
Exactly. And then the next category is drugs. And by drugs, I have a big range of things to talk about, because we can talk about illegal street drugs like cocaine, meth, heroin, things like that. But then I'm talking also about over-the-counter drugs like cough syrup that has alcohol in it, metabolized the same way as beer and things like that. Ibuprofen, it can be dangerous for babies. And then even topical creams like Retin-A on the face can impact the development of a baby. And then I also want to talk about prescription meds. So like Zantac for anxiety and depression, and then pain medications like hydrocodone or Oxycontin or things like that. They all can impact the baby as well. And I want to say here, I have to use my cheat sheet, there are some causes of withdrawal. So babies can have tremors, convulsions, difficulty breathing, intestinal disturbances. This all is included in the babies as well. And then one other drug I want to mention is caffeine. It affects the baby as well, because, and the best example I give on this is, when we don't have our caffeine as adults, like if you don't get that cup of coffee in the morning, some people get that headache. Well, when you're pregnant and you continue to use caffeine on a regular basis, after the baby is born, mama can go have a cup of coffee or a Dr. Pepper or whatever they want. Well, baby doesn't get that. So the baby's going to suffer through that withdrawal. And I don't think women think about that either. And even though it may be only a couple days that they have to deal with, still, I wouldn't want to put my baby through that. So it's best to refrain from caffeine as well. And the last drug I want to talk about is tobacco and nicotine. And that impacts birth weight traumatically. Studies have shown that way. And the development of newborns is impacted as well. It has been proven that maternal smoking increases the risk of spontaneous abortions, bleeding during pregnancy, premature rupturing of the amniotic sac, fecal death, and death of newborns. So if you would imagine living each day in a tiny little enclosed room that's smoke-filled, that's kind of what the baby's living in. So I would want to, refrain from that as well. So.
Now, what if, say a mom has just found out she's pregnant, she didn't know, and she'd already ingested alcohol? I mean, what happens in those circumstances?
Well, even if you've used drugs or alcohol, and some women have used it in a previous pregnancy and their baby turned out okay. Mm-hmm. The one thing that I have to say is, you stop using. The minute that you can stop using, the better off. The one cigarette that you can quit smoking, the baby's going to be better off. So there is good news to that. It's not that you can't stop, but the problem is it can impact greatly. It can harm your child's learning and behavior. And I don't think moms realize that. You're not going to see it. If your baby looks okay and fine, that doesn't mean your baby is okay, because a lot of times you don't see the impact of drugs or alcohol until later in life or when they're in school.
Mm-hmm. I know some personal acquaintances that went through that, friends in college that, even in college it affected them, the things that their mothers chose to do while they were still, in mommy's tummy. So it's a very important issue.
Exactly. And I think the most recommendation for people is that they should really think, if you're sexually active, you shouldn't be using drugs or alcohol, period. I mean, and that's kind of a hard thing to take for a lot of people, in society today. So it's important to remember that.
Yes, very much so. Now, if someone has more questions or, maybe they would like you to give a discussion about this to their group, what number would they call?
625-5521, and you could ask for me, or any of our prevention consultants could help you with that. But I'd love to come talk to whoever and educate them. It's important to know. So.
Well, thank you so much for this wonderful information. Parents, remember, you are your child's first and best teacher. So thank you so much for watching You and Your Young Child.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History.